Have you had time to revise the new words? As usual, we'll start with revision. So you can go to your Nearpod and I will open. Dr. Bibigul, Dr. Akmaral, you can join Nearpod. And so you all joined, am I right?
Yes.
Mm-hmm. So let's start the first exercise on revision of the words from the previous lesson. Okay, good. So discernible is различимый. And atrial fibrillation, atrial flutter, to faint. Это у нас вот эта картинка, да, как how you would translate faint?
Потерять сознание.
Мгм.
Падать в обморок, да?
Yes, терять сознание. And lightheadedness, предобморочное состояние. Comorbidities, сопутствующие заболевания. Okay, good. So going back to our lesson, so we will focus on ventricular arrhythmias and premature ventricular contractions. Today's objectives is to, as usual, learn key English terms related to arrhythmias, build communicative skills for describing ECG findings in English, and practice interpretation of rhythm strips. And also, next session, we actually will have a lesson on device terminology. So here are some 3 new words. Do you see my presentation?
Yes.
Yes.
Good. And we will learn more new words, but these 3 words are would be useful for our session today also. So, Dr. Yerkem, could you please read all of these words with translation?
Okay. First is premature ventricular contraction, желудочковая экстрасистола, monomorphic VT, ventricular tachycardia, мономорфная ЖТ, sudden cardiac disease, внезапная сердечная смерть.
Not disease, death.
Or death. Non-sustained ventricular tachycardia.
Non-sustained.
non-sustained
Мгм.
ventricular tachycardia, неустойчивая желудочковая тахикардия, polymorphic VT, ventricular tachycardia, полиморфная ЖТ,
Мгм.
consecutive, последовательный, subtained VT,
Sustained or
sustained,
sustained. Ага.
sustained VT, устойчивая ЖТ, torsades de pointes,
Мгм.
pure тахикардия,
Мгм.
и preceding, предшествующий,
Preceding. Мгм.
preceding, предшествующий, pacemaker электрокардиостимулятор, implantable кардиовертер дефибриллятор, имплантируемый кардиовертер дефибриллятор, cardiac resynchronization терапия, ресинхронизирующая терапия.
Мгм. Good.
Sustained, да?
Ага. Sustained or sustained, both would be correct. Which one is easier for you? And also here you see that again we have some abbreviations like PVC for premature ventricular contraction, NSVT, non-sustained ventricular tachycardia, ICD, implantable cardioverter defibrillator, and CRT, cardiac resynchronization therapy. So these abbreviations are also could be used while you're speaking, like ICD or CRT. I guess the same for in Russian, yes?
Yes.
Mm-hmm. They usually use like ИКД, да?
Мгм.
Mm-hmm. So here is some warm-up discussion questions. As usual, Dr. Bibigul, Dr. Akmaral, which ventricular arrhythmias do you find most challenging to diagnose quickly on ECG? Какие желудочковые аритмии для вас являются самыми такими сложными быстро определить на ЭКГ?
Это
Как вы думаете? Мгм.
venтрикулярную, да, именно, да?
Мгм. You can talk about also supraventricular if you want.
Ну, supraventricular arrhythmia, it's easy.
Мгм.
Ventricular arrhythmia, it's no problems, but fibrillations,
А,
ventricular fibrillations, sometimes it is
мгм.
difficult for me.
Мгм. Мгм. What about Dr. Бибигуль?
For me, to find pirouette tachycardia on ECG
Мгм. Torsades de
it's
Pointes.
yes is more difficult than other ventricular arrhythmias.
Мгм. It's also for me, actually. It's a bit harder. I agree with you. And what drugs are usually or commonly used for acute management of ventricular arrhythmia? Or do we use some drugs?
Бета-блокеры?
We
Mhm.
used cordaron or sandaron,
Мгм.
300 milligrams, да?
Мгм.
Если я не путаю.
Okay, and anything else? In discussion part, I like advise you to answer in full question or on full sentences, okay? So you can practice.
Okay, if
Mhm.
we see on ECG wild formed QRS,
Мгм.
tachycardias, we manage this
Mhm.
patient как ventricular arrhythmia,
Okay.
ventricular tachycardia.
Mhm. But actually, usually we start with defibrillation, or am I wrong? And then yes, we can use some additional.
Defibrillation we
Uh-huh.
use if patient
When,
patient is unstable.
uh-huh.
Как if patient
Мгм.
fainted,
Ага.
and we don't feel the pulse.
The pulse. Okay. And actually, could you please explain the difference between cardioversion and defibrillation?
Cardioversion we use to more of ventricular arrhythmias.
Мгм.
But defibrillation we use only for fibrillation of ventricular fibrillation.
Okay. I understand. Okay. And also, do you know сердечно-легочная реанимация, how it would be called in Russian? Oh, in English, I'm
In
sorry.
English,
Yes.
CPR, CPR.
Yes, CPR, and fully its abbreviation is CPR.
cardiac, не знаю.
Мгм.
Cardio.
P, also pulmonary.
Pulmonary.
Cardiopulmonary. Да.
Resuscitation.
Мгм.
Cardiopulmonary resuscitation. Okay, good. Here is some sample answer, but you already answered all of these questions. If you want, we can read to practice. Dr. Akmaral, maybe starting with you. Let's start with drugs for acute management.
Так, drugs for acute management of ventricular arrhythmias. Amiodarone. Amiodarone, often first line for drug.
Here we have, do you remember routes of administration of the drug? It's
Sustained.
No. Maybe someone could help.
Amiodarone?
No, I mean here, it's not for, it's
IV.
Ой, sorry, IV drug. Это ventricular venous.
Intravenous.
Ventravenous. Drug to sustained.
Sustained.
Sustained. VT это же такое?
VT it's ventricular tachycardia. Желудочковая
tachycardia. Especially in hemodynamically stable patients.
Good.
Так,
How you would translate?
Translate. Так, амидарон это первая линия, да? Препарат первой линии, внутривенно, да, используется.
Внутривенный препарат, да, первой
внутривенный
линии.
препарат используется при желудочковом тахикардии.
Which one? What is sustained?
Hemodynamical stable patients. Хемодинамически стабильные.
What does it mean sustained VT? It's устойчивая желудочковая тахикардия. Yes?
Устойчивая же это, да.
Sustained устойчивая.
Устойчивая, да?
Non-sustained it's неустойчивая.
Да, неустойчивая.
It's okay, it's a new word of today.
Так, этот...
Especially.
Особенно.
Особенно в гемодинамика стабильных пациентов, да?
Да, пациентов гемодинамически стабильных, да? Good. Next, beta-blockers.
Так, beta-blockers important in suppressing sympathetic drive, especially in VT related to ischemia or long QT.
Yes.
Так, важным suppressing симпатический драйв, да, это как?
Suppressing, как переводится?
Suppressing,
подавлять.
Подавлять,
да, симпатическую нервную систему, да?
Yes, it means here we can translate not directly как симпатическую активность, да, подавляем.
Симпатическую активность, особенно желудочковую тахикардию, related to, это как направляется,
Ну,
как related,
связанный,
related.
да?
Связано,
Связанный.
связано с ишемией или это так пролонгированный КУТ?
Yes, great. Окей.
Мгм.
Lidocaine?
Так, lidocaine can be used in ischemia-related
Ischemia?
ischemia-related VT or VF, less effective than amiodarone, but useful in acute MI settings.
Good.
Так, можем использовать, так, ишемия
Ischemia
желудочковой.
related, this is, you see, like in previous in beta blockers, it was VT related to ischemia, and here we have ischemia related VT. Both of these are translated exactly the same, but the order is different. То есть здесь уже идет желудочковая тахикардия, связанная с ишемией. But here is the same, related to ischemia, VT related to ischemia. You can like change the order, yes, of the words, but the meaning is the same.
Или желудочковая фибрилляция, да?
Yes.
Less уменьшает эффективность,
Less effective, менее эффективный.
Менее эффективный, потому что амиодарон может...
Here you see less effective than means менее эффективный, чем. Как сравнение идет.
Да, сравнение than. Амиодарона, но используется в остром инфаркте. MI settings.
Yes, you're right. Useful переводится полезный, да? MI settings means, когда у нас идет ситуация с myocardial infarction, да? Инфаркт миокарда. Okay. And the last one, magnesium sulfate.
Так, magnesium сульфатом. Drug of choice for dorsada de points, even with normal serum magnesium. Магнезия, да? Тогда драг используется для, как бы сказать, так, препарат выбора, да?
Yes.
Для дорсада де поинца, даже с нормальным, что такое, магнезием, да, или что такое?
Yes. То есть уровнем магния в плазме.
Да, с нормальным магнием.
So serum это у нас идет плазма.
Серум это
So,
плазма,
for
да?
example, it could be translated as plasma as well. То есть the same meaning. Okay? And let's Dr. Yerkem. Yes, I haven't heard you.
Yes.
For a long. So please, could you read meanings of cardioversion and defibrillation?
Cardioversion delivers an electrical shock synchronized with the QRS complex to rest the rhythm safely in patients with organized arrhythmias like atrial fibrillation or stable VT. Доставляет электрический шок, но электрический удар получается синхронизированно с комплексами QRS, чтобы восстановить ритм у сохранных пациентов с
not сохранный, it means like безопасно для пациента.
Безопасно пациентам с organized arrhythmias. Это как будет?
Organized переводится организованный, и there is the meaning that how to say, когда у нас обычный комплексы имеется в виду, как сказать?
Все.
Could you please help me to
Когда
explain
комплекс
this.
КРС получается у нас нормальный, там
Yes,
такой не шоковый, да?
да, более
Да.
организованный, да, вот в таком ключе. Мгм.
С организованными аритмиями, такими как фибрилляция предсердий и стабильное ЖТ.
Мгм.
Defibrillation delivers an unsynchronized shock at any point in the cycle used in life-threatening arrhythmias like VF or pulseless VT, where there are no organized rhythm. Доставляет несинхронизированный разряд на любую часть цикла, на любой момент цикла, используется в жизни, при жизнеугрожающих аритмиях, таких как фибрилляция желудочков, либо же ЖТ без пульса, наверное, да? Когда ритм не организованный.
Yes, great. So here is just the sample answers for the warm-up discussion questions. Okay? But you told the same things, but in your own words. It was also correct. Here, now we will move to the exercise 2 with a new vocabulary in your Nearpod. So I will open.
У нас запись идет же, да?
Да, не включен?
Я не знаю. Просто у меня, когда заходила, высвечивалась запись и так далее, вы согласны и так далее, такого не вышло у меня.
Сейчас, давайте я проверю, пока вы делаете. Все идет.
Спасибо.
Okay, let's check. How was the new words for you? Is it hard to remember for now? What do you think? Or it's easy?
I think it's medium.
Okay. So ICD it's ИКД, pacemaker электрокардиостимулятор, PVC желудочковая экстрасистола, sustained VT устойчивая ЖТ, polymorphic VT полиморфная ЖТ, sudden cardiac death внезапная сердечная смерть, consecutive последовательный и preceding предшествующий. Okay. So let's go to the presentation. You see the presentation now? Right?
Yes.
Mm-hmm. Now we have some reading. Dr. Akmaral, please start with the first sentence.
Так. Ventricle contractions, PVC, да?
Мгм.
And ventricular tachyarrhythmias arise from abnormal impulse formations or conductions
Conduction.
within the ventricles.
Мгм.
Это
Conduction.
будет как
Ага.
это, да?
How was... Мгм.
Так, conduction within the ventricles. Permature ventricle contractions это так, как желудочковые.
Someone could help. Как это было?
Преждевременное?
Мгм.
Extrasystole.
Ага. Это экстрасистолы, да? То, что мы...
Да.
Ага.
Желудочка тахикардия
Мгм.
или желудочка тахикардия.
Мгм. Arise.
Тахиаритмия.
Мгм. I think I can't hear you, Dr. Akmaral. Or maybe I have some connection problems. Dr. Bibigul? Dr. Ikem, can you hear Dr. Akmaral well?
No.
No?
No.
I think she has some.
Within the ventricles, да, идет?
Доктор Акмарал, мы вас не слышали. Could you
Так.
please repeat?
Сейчас
you
слышно,
have-
да?
Yes,
Сейчас слышно, да?
now it's good.
Так, слышно, да?
Мгм.
Так, желудочковые экстрасистолы,
Мгм.
желудочка тахиаритмия,
Мгм. Arise.
rise, это вот не помню, что слово было, rise.
Ага. Возникают.
И раз возникает
Мгм.
при нормальном, да, импульсе, да?
No, abnormal, it's наоборот, opposite of.
Ненормальном импульсе, да?
Ага.
Да, abnormal же идет. В нормальном импульсе formations это...
То есть формирование неправильных импульсов.
Formation
Ага.
и неправильное
Мгм.
формирование или
Или.
conduction, это, как бы сказать, проводимости, да?
Yes. Ага. Right.
Within с желудочками.
Ага. Within, внутри, да? В
Да,
желудочках.
внутри желудочки.
Мгм. Okay, good. Dr. Bibigul, you can read the next two sentences.
Yes, PVCs may occur in healthy individuals, but can also indicate underlying structural heart disease.
Мгм.
ЖЭС могут
Мгм.
случаться у здоровых людей, да,
Мгм.
но также могут
Indicate.
как сказать,
Указывать.
да, указывать на основолежащем, да, структурных заболеваниях сердца.
Мгм.
Non-sustained,
Yes, you can read.
non-sustained ventricular tachycardia is defined as more 3 consecutive ventricular beats
Мгм.
lasting less 30 seconds
Мгм.
and may be associated with increased risk in patients with cardiomyopathy.
Cardiomyopathy. Here you see the like more than and less than. Do not forget about the than.
Окей,
То есть у вас тоже
окей.
менее чем, либо больше чем.
Мгм.
Okay. Let's translate.
Неустойчивость желудочковая тахикардия is defined, определяется, да?
Right.
Определяется как больше 3
Мгм.
последовательных желудочковых импульсов,
Мгм.
ударов или продолжающихся, да?
Yes.
Менее 30 секунд и могут ассоциироваться с повышенным риском у пациентов с кардиомиопатиями.
Yes, great, Dr. Bivigul, good job. And Dr. Yirke, you can read the last two sentences.
Sustained ventricular tachyarrhythmia usually requires urgent treatment and may indicate the need for ECD implantation. Carbonization therapy is recommended in selected patients with heart failure, reduced ejection fraction, and conduction delay, especially left bundle branch block. Устойчивая желудочковая тахиарритмия обычно требует неотложного лечения и может указывать на то, что нужно использовать имплантацию ИКД.
Great.
Сердечная ресинхронизирующая терапия рекомендуется определенным пациентам как с сердечной недостаточностью, со сниженной фракцией выброса и с проведением импульса conduction.
Conduction? How it be? Delay?
Замедлением проведения
Да,
импульса.
задержка проведения.
Задержка проведения импульса. И также
особенности
у пациента с блокадой левой ножки пучка Гисса.
Yes, great. Actually, I want now to tell you about the word urgent, and we have the word emergency, right? They are, do you know how they are different? So we have urgent, which is срочный, while emergency is, то есть,
Экстренно.
Да, экстренно. То есть these two meanings are also used, but for example, in the treatment of patients, in some maybe guidelines, you may see like this is urgent, but in emergency cases, you use another therapy. I don't know, maybe in hypertension it was, if I'm not mistaken. We will see it also. I guess the 8th lesson, if I'm not mistaken, is on hypertension topic. Okay. Now we move to our grammar tip. We have sometimes you see the structures, yes, where in sentences we see comparison, yes. So to compare, for example, two drugs or two different diagnoses, and we can use it while discussing as well the ECGs, arrhythmias, and differential diagnosis. So there are three phrases: compared with, по сравнению с. То есть we use it, for example, for two different diagnoses or rhythm. То есть когда вот видите X, Y, да, то есть compared with atrial fibrillation, atrial flutter has more organized atrial activity. For example, while in contrast to, это в отличие от, we can use in the sentences like in contrast to SVT, VT presents with wide QRS complexes. And whereas it's в то время как, то есть контраст в одном предложении. They all could be used interchangeably, то есть мы можем использовать как и по сравнению с, в отличие от, в то время как, так же, как и на русском языке, да? Of course, it would be more clear when you use it, when you practice on that topics. We will now practice. Now here I would translate for you compared with atrial fibrillation. I think it's clear, да? То есть по сравнению с... how you would translate atrial fibrillation?
Фибрилляция предсердием, питание предсердием.
Yes, has more organized atrial activity. Имеет более организованную, да, предсердную активность. In contrast to sustained VT, VT presents with wide QRS complex. В отличие от SVT, VT имеет более широкий, да, QRS complex. And the last one, whereas PVC are isolated beats, and SVT lasts several seconds, да? Здесь то же самое. В принципе, их можно между собой сочетать. Это тоже не будет ошибкой. Okay, now to make it more clear, we need to practice. Here I have some sentences, like for example, AF, atrial fibrillation, has no consistent P waves. Flutter has sawtooth wave. And now I need to rewrite these two sentences in one sentence using these structures. For example, I will show you. Compared with atrial fibrillation, atrial flutter has sawtooth waves. Yes? Here you could not use, for example, this non-consistent P waves, just use as comparison. Okay, for example, Dr. Yerkem, you can try the second sentence.
In contrast to CVT, VT has wide QRS complexes.
Yes, great. In contrast to SVT, VT has wide QRS complexes. And also, in other way, you can also tell, like, compared with SVT, VT has wide QRS complex. It will be also correct. Yes? Okay. Next sentence, Dr. Bibigul. Third one.
Compared with monomorphic VT, polymorphic VT has varying morphology.
Good. It's also we can use in contrast to or compared with. Okay. Dr. Akmaral, are you here?
The AF is regular. Atrial flutters is often regular with fixed block. Я тут вообще не поняла.
Ага, здесь мы, получается, перефразируем вот эти два предложения и делаем из него одно предложение, да, используя данные слова.
Тогда the contrast
in contrast to
in contrast to atrial flutters is often regular or irregular.
Here you can tell, like, например, да, в сравнении с AFib, да, atrial flutter у нас имеет регулярный ритм, да? То же самое мы говорим на английском языке. То есть compared with AF, atrial flutter is often more regular. То есть these words are used for сравнение, да? Они все имеют одинаковые в принципе значения. Если вы поменяете их местами, суть не поменяется. Но можно использовать как и in contrast to, compared to, and whereas. Окей? Просто чтобы сравнивать различные заболевания или какую-то терапию. Есть ли вопросы по этому? Do you have questions?
Нет.
Okay. And here we have clinical case. Dr. Akmaral, could you please read?
50-year-old man who had come to the accident and emergencies department with chest pain collapsed while his ACG was being recorded, what happened and what would you do?
Here is his ECG. Yes.
ECG, yes.
Mhm.
VT, да?
What do you think the patient has? Ventricular tachycardia?
Желудочковая тахикардия же, VT.
Okay. We will check next. Let's start as we usually yes, from the rhythm, heartbeat. Yes.
Достаточно the points, да, в конце там идет, да?
How you would translate the word collapsed? Here, collapsed while his ECG was being recorded. 50-летний мужчина, да, поступил в приемный покой с болью в
Боль в
груди.
груди.
Ага. И когда ему делали ЭКГ, ему, ну, то есть во время его ЭКГ он
У него развился
потерял
коллапс, да?
сознание. Yes.
Коллапс,
Потерял сознание. Sometimes you could see like collapsed instead of to faint. Yes. And what happened and what would you do? You think it's torsade de pointes, and what would you do for this patient? Please answer in full sentences, okay? Or maybe someone disagree with the diagnosis. Dr. Ikem, Dr. Bibigul.
I think patient have the MI, and also after MI, it's continues to the VT. So the first we need to measure blood pressure, the saturation, and also if patient unstable, we need to cardioversion.
Why do you think the patient has had VT and then?
No VT is фибрилляция
MI.
желудочков.
Вы MI имеете в виду, and then fibrillation.
MI because I see the ST segment elevation, and if this is the отведение the first, the second and third, maybe the patient has the MI in inferior part of the left ventricular, and we see not VT. The first may be VT, but after the ventricular fibrillation.
Okay. We have here Dr. Bipigul. Do you agree with Dr. Irkem and Dr. Akmaral?
Yes, I agree. MI and короче, потом continuous идет dorsal the points.
Okay. Dr. Bibigul, what do you think?
I think that the patient had an MI with ST segment elevation, and then it's развился ventricular fibrillation, I think.
Okay. Just to focus one more thing. You see the screen, right?
Yes.
For example, when you are talking about your opinion, you usually use, for example, I think, yes? What other words you can use to say, like, я думаю, когда вы что-то говорите о своем мнении, да? What do you know, like, I think? Any synonyms?
In my point.
In my opinion or in my point. What else? You can also tell, I guess, I believe, да, я верю. Anything else? This is the words that are usually used. I just want to, how to say, чтобы not always, you should not always use like I think. It's better to change, yes, the words. And there are many words actually. I guess, I believe, I suppose that it would be я предполагаю. Is it clear?
Yes.
Actually, just for your information, if you want, while we're discussing something, you can use some of these phrases. Okay. So let's check the ECG findings. Dr. Yerkem, please, could you read everything?
And 3-minute 55 beats 1
Beats
minute.
per minute.
Per minute with ventricular extrasystoles. The third extrasystole occurs on the peak of the T wave on the preceding sinus beat. After 3 or 4 beats of ventricular tachycardia, ventricular fibrillation develops. In the sinus beats, there is Q wave in lead 3, and there are raised ST segments in lead 2nd and 3, and ST segment depression and T wave inversion in lead 1. Probably inferior myocardial infarction, air on T ventricular extrasystole causing ventricular fibrillation. Синусовый ритм, сокращение 55 ударов в минуту с желудочковыми экстрасистолами.
We can skip translation, I think.
Okay.
Just we are checking that you told everything right. That's good. And here I have some clinical analysis and management. Dr. Bibigul, you can read this one. Dr. Bibigul, are you here? I think I can't hear you.
Cardaron?
Dr. Kamaral, you are answering the question?
In my opinion, Cardaron
would be
Cardaron в основном делается же. Так, там же идет инфаркт же идет же. Кардарон и этот антикоагулянтную терапию же там, да, что-то. Ну, в принципе.
Dr. Akmaral, please answer in English, okay? In full sentence. You said, in my opinion, Cardaron.
In my opinion, Cardaron and anticoagulant therapy
would be the next step management.
Да, step management and continuous cardioversions.
And then you...
I think cardioversions therapy же.
Should be performed.
Yes.
Okay. While answering, do not forget to answer in full sentences, okay?
Okay.
То есть полными предложениями, да, стараемся говорить. Okay. So here, from this publication, they give answer as immediate defibrillation, but if no defibrillator at hand, then cardiopulmonary resuscitation should be performed according to advanced life support guidelines. Before this, answering this question, please, Dr. Vivigul, could you read this one, the clinical analysis and management?
Clinical analysis and management. Also, only leads 1, 2, and 3 are available. It looks as if the chest pain was due to an inferior myocardial infarction. This was probably the cause of the ventricular extrasystoles and an R on T extrasystole caused ventricular tachycardia, which rapidly decayed into ventricular fibrillation. It might be argued that in LED 3 and perhaps also in LED 1. Tarsadas the points ventricular tachycardia is present, but this is not apparent in LED 2.
So here they say yes, то можно как бы поспорить, то в отведениях 3, да, и, возможно, в отведении 1, torsade de points у нас есть, да, но он не... How would you translate not apparent?
Не представлен, да?
Да, в автоедении 2. And also the word decayed, which rapidly decayed. How it's translated?
Превратился,
No.
развился, может, нет.
Так, how to say? Decay means how, как разлагаться, да? And there is meaning like пропал, можно сказать. Или превратился, да, можно тоже с одной стороны. In this meaning. Decay is usually used in, for example, when we are talking about some, I don't know, archaeology. When you're talking about, I don't know, some decayed bones of dinosaurs in that meaning. Here they use the meaning a little bit different. Okay. Because the patient was collapsed, they suggest that immediate defibrillation should be performed. And what do you know what is an at hand means here? But if no defibrillator is at hand.
Наличие в руках, типа, да?
Да, то есть под рукой.
Доступности, ага.
Доступности, yes. Тогда должно быть проведено СЛР, да? Okay, so sorry. Now we have also the exercise 3 in the NIPOT. Here you need to find the definition in these sentences. Dr. Irkem, you already finished. Dr. Vikul, okay. And here you see the answers, am I right?
Yes.
So device that prevents sudden cardiac death is ICD, premature ventricular beat PVC, less than 30 seconds of ventricular tachycardia NSVT, polymorphic VT with twisting axis torsade, and therapy for HF with conduction delay is TRT. Okay. I guess everything was correct in your answers. Now we have some matching pairs definition. Let's do it quickly, like, oops, I'm sorry. Here you see the terms and you need to find definitions in the lower part. Like, for example, premature ventricular complex. You need to find the definition of that in this within these 7 sentences. Okay, maybe Dr. Pipikul, let's start with you.
Premature ventricular complex, получается, желудочек систола.
You have time to go through these sentences?
Premature occurrence, да?
We will check later. You see the premature occurrence of an abnormal QRS. Yes. Okay. Next one, Dr. Irke, unifocal or monomorphic PVC.
Unifocal monopole PVC. PVC with different QRS morphologies.
If I'm not mistaken, yes, it's right. Okay, Dr. Akmaral. Third one, multifocal, multiform, polymorphic PVC. Вам нужно найти значение, да? Ага. If you have some questions regarding the words, you can ask.
Maybe 6, да, это consecutive.
More than 3 consecutive beats?
Да, more than.
Okay.
More than 3 consecutive.
Okay, we will check in the next slide. Dr. Irke, for the first one, short coupled PVC.
Short coupled. Это как парные, да? Желудочка экстрасиста. Да.
Парные, да, жест.
PVC with a single QRS morphology. Yes, maybe PVC with, I don't know.
Okay, we can skip some. Oops, I'm sorry. I showed you the answers. So we can skip some parts, for example.
Yes.
And move for ventricular tachycardia. If you find them, it would be easier to find others. For example, ventricular tachycardia is, what do you think?
The four, the chaotic rhythm and undulations that are irregular in timing and morphology. Maybe this is ventricular fibrillation.
Okay. Do you know how the word undulation is translated here? Chaotic rhythm is undulation. It means волнообразные движения. The word. Неровные, да? Скажем. Chaotic?
Хаотичные.
Right. Okay, Dr. Biugul, Dr. Akmaral, you can also, if you find some definitions, tell.
Non-sustained ventricular tachycardia.
None of consecutive ventricular beats persisting for 3 beats to 30 seconds.
The third one, yes?
Yes.
Yes, you are talking about NSVT?
Yes.
Okay. And short coupled PVC is left, yes?
Это, наверное, 7-й, потому что только 7-й остается.
Right, the 7th should be correct. PVC that interrupts the T wave of the preceding conducted bit. То есть жест, который how interrupt
накладывается.
С волной Т, да? Зубцом Т. Preceding.
И предшествующий.
Предшествующий. Прощение.
Okay, let's check. I think it was correct. Premature ventricular complex premature occurrence of an abnormal QRS. Unifocal PVC with a single QRS, while multifocal PVC with different QRS morphology. Short couple, yes, we were right, it was sevens. Ventricular tachycardia, more than 3 consecutive beats with a rate 100 beats per minute. Ventricular fibrillation, chaotic rhythm with undulations. And NSVT, run of consecutive ventricular beats. Okay, everything was correct. Okay, and now we have the fourth exercise in Nearpod. Let's move to the Nearpod. For this exercise, you will need maybe more time because it's reading. So you have time to do it. Also here, you just fill in the blanks. If you have questions, you can ask maybe some translation. Dr. Bibigul, how was it for you? This is like more epidemiological, yes, paragraph.
Yes, it's more numbers.
Yes. For me, for example, reading such kind of paragraph is more challenging than the other ones because there are
Yes.
some statistical, how to say, terms, yes?
Yes.
I just wanted you to see this kind of words also, because I guess you read some scientific papers and researches, or maybe write them.
Yes, but it's very, very rare. Такое есть слово.
Да, редко, да, имеете в виду? But I guess after finishing this course, you will be able to read some papers easy. It would be easy for you.
We finished this course at 3rd February, yes?
I guess in February, yes, if I'm not mistaken, we'll have final exam.
Final
on the
exam.
3rd of February, yes.
Okay.
Mm-hmm.
How it will be our final exam?
It would be actually on all the topics that we covered, yes, and we will cover some others. And у вас будет как билеты, да? Some maybe terminology or diagnostic methods, management plan. It would not be like anything extra, not from the topics that we have not covered. It will be everything you know. So you will need just to revise everything.
Okay. And after how we finished our course, we can watch this our lessons.
I guess yes. You will have the links with you to watch.
Okay, thank you.
Okay, so let's check. So here, the words incidence, it's заболеваемость, and also you have the word prevalence. Это у нас распространенность. These two words are like the basics of statistics. There's incidence and prevalence. Usually maybe you saw, noticed in some studies, in research papers, that they usually have graphics with incidence and prevalence. So here заболеваемость, да, но на русском языке немножко вот термин заболеваемость обозначает по-другому, да, but incidence это вот не всегда будет как обозначать заболевание, потому что sudden cardiac death it's not like a disease, yes, но тут как статистическое значение заболеваемости. The incidence of sudden cardiac death increases markedly with age. Here you also see, which one I wanted, how riches is translated. In the eighth decade of life, it reaches an annual incidence, то есть годовая заболеваемость, да? At least 200 per 100,000 person years. Person years – это человека год. То есть если мы будем наблюдать за пациентами целый год, то за 100 тысячами пациентов в течение одного года 200 из них, да, у них будет sudden cardiac death в таком ключе. I don't know actually in Russian if they use this term человека год, but in English you may also see this person years. Actually, all of these terms in statistics, it's better to go through them actually by definition, because they are a little different from Russian literature. Okay. Do you have questions on this reading? Dr. Yerkem, Dr. Akmaral?
No questions.
Dr. Yerkem?
No, but I don't know some words, so I need to translate them after.
But any other questions, or you can ask some translations?
An annual incidency that you say?
Annual incidence. Ага. То есть annual – это за год, да, заболеваемость. Ага. Annual usually used as как год, годичный. Anything else?
And at any age, males have higher sudden cardiac death rates compared with females even after adjustment for the risk factors of coronary artery disease. Получается, как в некотором возрасте, там,
в любом возрасте. То есть здесь here they how to say explain their findings. I just took this paragraph from the paper. yes, from the research. And they mean like at any age they took, то есть в любом возрасте, который они исследовали пациентов, у мужчин был выше риск, да, sudden cardiac death в сравнении с женщинами. Even after adjustment имеется в виду именно статистическое значение, когда how to say, у нас же есть различные, да, как называют, hazard ratio, or I don't know, какие еще были статистические значения, именно adjustment
да?
используется, да, именно вот именно их исследование статистическом, да, которые они вот в программах делают в этом плане, имеется в виду adjustment. Adjustment, how you would translate this word? То есть коррегирование, да, когда какие-то цифры, они друг другу коррегируют. Именно когда оценивают риск-факторы, такие как coronary artery disease. Yes. Actually, to understand this, you need to like go through the definitions of statistical analysis. То есть это больше как научная часть, да?
Okay. Thank you.
Okay, so I think that's it for today. I'm really happy that you joined today's lesson. Do you have any questions from today's topic and how it was for today?
No.
Everything is clear?
Yes.
Доктор Акмарал, у вас как?